Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the duodenum. The duodenum is the highest, shortest, widest and most fixed part of the small intestine. So this is the duodenum. It looks like the alphabet C around the head of the pancreas. It extends from the pyloric sphincter to the duodenojejunal fracture. This is extending from here from the pyloric sphincter and it goes to the duodenojejunal fracture here. It is retroperitoneal except the initial 2.5 centimeter, that is the duodenal cap, that has attachment to the hepatoduodenal ligament, part of the lesser omentum, and also it is attachment to the greater omentum in the lower part. Otherwise, it is retroperitoneal. It has C-shape. It is C-shaped and curved around the head of the pancreas, lies above the umbilicus at the level of the body of the lumbar vertebra 1 to lumbar vertebra 3. It is about 25 centimeter in an adult person. First part of the duodenum about 5 centimeter in length, extends from the pyloric sphincter. This is the pyloric sphincter in a contrast radiograph. Okay, so this part is the duodenal cap. Okay, this is the duodenal cap. This is the pyloric sphincter. And the first part is at the level of the lumbar vertebra 1, passes anterior to the bile duct, gastroduodenal artery, portal vein and inferior vena cava. So these structures are posterior to the first part of the duodenum. Gallbladder is anterior to the first part of the duodenum. The initial part is called duodenal cap. It has a lot of clinical importance, specifically for the site of peptic ulcer formation. Most of the peptic ulcer develops here. Okay, anterior relationship here. Anterior relationship here, we are seeing the gallbladder here. Here, the superior, here is the blood vessel, superior mesenteric vein, and superior mesenteric artery passes anterior to the third part of the duodenum. This is the first part, or superior part. This is the descending part or second part. This is the third part, and this is the fourth part. So the superior mesenteric vein, mesenteric artery passes over the third part of the duodenum. The gallbladder is related to the superior part of the duodenum, including the including the junction between the superior part and the descending part, depending on the size of the gallbladder. Posterior relationship, we have the bile duct, that is posterior, the artery, gastroduodenal artery, that is a branch of the common hepatic artery, that is behind. The portal vein is behind the first part of the duodenum. Okay, so anteriorly the gallbladder, posteriorly this structure, the bile duct, portal vein and gastroduodenal artery. Posterior to the descending part of the duodenum or second part, we have the right kidney, right ureter. Okay, posterior to the third part of the duodenum, we have the inferior vena cava and the abdominal aorta. So these are the relationship to that of the duodenum. Okay, second part, the duodenum is 7.5 centimeter, extends to the level of the lumbar vertebra 3. Anterior surface is crossed by the transverse column. Right kidney lies posterior to it. Okay, if we go to the previous image again, anterior part is crossed by the attachment of the transverse column, and the lower part of the superior part of the or first part of the duodenum has the right end of the gastrocolic omentum, that is the part of the greater omentum. Okay. The second part of the duodenum has the major duodenal papilla and minor duodenal papilla. Here is the major duodenal papilla, minor duodenal papilla. Minor duodenal papilla for accessory pancreatic duct, major duodenal papilla for the end of the main pancreatic duct, and it is uniting with that of the common bile duct to form the hepatopancreatic duct with an ampulla that opens into the major duodenal papilla. So the major duodenal papilla, we have the main pancreatic duct and the bile duct, common bile duct. They unite to form the hepatopancreatic duct they form an ampulla that opens into the major duodenal papilla. Third part of the duodenum, it crosses the inferior vena cava, aorta and vertebral column. Superior mesenteric vessel passes anterior to it. Here is the superior mesenteric artery, superior mesenteric vein. There is a tributary of portal vein. Superior mesenteric artery is a branch of the ventral branch of the abdominal aorta that passes over it. The fourth part of the duodenum passes upwards and to the left of the aorta. This is the fourth part of the duodenum to the level of lumbar vertebra 3 and terminates at the duodenojejunal junction. This is the duodenojejunal junction. The duodenojejunal junction is surrounded by the suspensory ligament of duodenum, also called ligament of Trietz. This is the ligament of Trietz or suspensory muscle. It contains some skeletal muscle from the right crest of the diaphragm close to the esophagus. It also contains elastic fiber and a few smooth muscle fiber in the lower part. It contains 2 layers of the peritoneum. This is not the mesentery for the duodenum, but it is suspending the duodenojejunal junction or flexure. Blood supply of the duodenum is very important. Blood supply is important to us because the upper part of the duodenum develops from the foregut, the lower half develops from the midgut. The junction is the major duodenal papilla. Below that, the part of the duodenum that is forming from the midgut. Above the opening of the major duodenal papilla, opening of the hepatopancreatic duct at the major duodenal papilla, this part is a derivative of the foregut. This part has blood supply from the celiac trunk. There is the gastroduodenal artery. That is a branch of the common hepatic artery. That is a branch of the celiac trunk. This part, lower part, third part, part of the second part, lower half, and the fourth part is getting blood supply from the inferior pancreaticoduodenal artery. It is anterior posterior branch. Upper part from the gastroduodenal artery, it has again the superior pancreaticoduodenal artery, again anterior branch and posterior branch. So gastroduodenal artery has 2 branches, superior pancreaticoduodenal artery that has anterior and posterior branch. The superior mesenteric artery has a branch, inferior pancreaticoduodenal artery, that has also anterior and posterior branch. They have anastomosis, but this is a artery of the midgut. This is an artery of the foregut. Lymphatics go to the pancreaticoduodenal lymph node. Nerve supply, sympathetic from T9 to T10, parasympathetic from vagus nerve through the celiac plexus. Okay, so before going to the clinical correlations, we have to say that the little bit histology, it is in small intestine, so it should be lined by simple columnar epithelium. We have villi and also the crypts of Lieberkühn and permanent fold of mucosa and submucosa we have permanent circular fold inside the wall of the small intestine, that is the duodenum. And the initial part of the duodenum has some mucus secreting gland called Brunner's gland that secretes alkaline secretion to counter the acid from the stomach. Okay, so we have some clinical correlation. Peptic ulcer, it may happen in the stomach, maybe in the duodenal cap. Duodenal cap is a common site of peptic ulcer. Duodenal cap is the initial dilated part of the first part of the duodenum or superior part of the duodenum. There may be some developmental anomaly. There may be stenosis, even atresia of the duodenum is possible, or it may be constricted by the annular pancreas that may cause obstruction. Even it may lead to polyhydramnios during the intrauterine life. There may be obstruction, so the fetus cannot swallow the amniotic fluid. There may be polyhydramnios due to obstruction by annular pancreas or stenosis of the duodenum or the atresia of the duodenum. Gallstone in the duodenum is possible. So sometimes what happens, because gallbladder contains a lot of gallstone, or it may be large, one or two solitary gallstone that may irritate the gallbladder. There may be fistula, communication between the gallbladder and the duodenum is possible, and the gallstone, if it is large, it may be blocked in the ileocecal junction that may lead to intestinal obstruction. If it is very small, then it may come out without any type of problem. Okay, so that's all about the anatomy of the duodenum. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.